Hello, and thank you so much for joining me. My name is Melissa Devine. I am one of the site coordinators for the Medicare and Medicaid Assistance Program through the Area Agency on Aging 1B. Today, we're going to discuss Medicare and employer-based coverage. We'll get into specifics on who MAP is, what MAP does, understanding Medicare, and how Medicare coordinates their benefits with programs like HSAs, COBRA, federal employee health benefits, and retiree coverage. Get started here with the MAP Inc. program. MAP Inc. is the Medicare and Medicaid Assistance Program. Our MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company and they are not licensed to sell insurance. In many states, MAP is called the SHIP program or the State Health Insurance Program. We are located all across the state of Michigan, offering free health benefit counseling assistance and education with outreach through presentations. So a MAP counselor can help you understand Medicare health plans, compare and enroll you in Medicare Advantage coverage, compare and enroll you in Medicare prescription drug coverage, can help you identify and report Medicare and Medicaid fraud and scams, and assist you with enrollment into low-income programs like the LIS Extra Help Program or Medicaid. Now let's take a look at Medicare. Medicare is health insurance for three groups of people: those 65 and older, those under 65 with certain disabilities, those of any age with end-stage renal disease. It is administered through the Centers for Medicare and Medicaid Services, with enrollments taking place through Social Security for most and the Railroad Retirement Board for railroad retirees. Medicare does have well-defined benefits and exclusions. It does not cover dental, hearing, or vision care except under special circumstances. It does not cover long-term custodial care. It does place limits on certain care items such as physical therapy, durable medical equipment, and more. And it does not cover over-the-counter medications. But Medicare does work with private insurance companies to provide Part D prescription drug coverage, supplemental or Medigap plans to help fill in the gaps in the original Medicare costs, and with Advantage plans to combine parts of original Medicare, usually with prescription coverage and often some dental, hearing, and vision coverage. There are 4 parts to Medicare. There is Part A, hospital insurance, Part B, medical insurance, Part D, prescription drug coverage, and Part C, Medicare Advantage plans. These are the HMOs and the PPOs. Now, when you first enroll in Medicare, and of course, during certain times of the year, you can choose how you get your Medicare coverage. There's 2 main ways to getting your Medicare coverage. The first is with Original Medicare. Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. And then you can add a drug plan onto your coverage by joining a separate Medicare Part D plan. And to help pay your out-of-pocket costs in Original Medicare, like your 20% coinsurances, you can also shop for and buy a supplemental or Medigap policy. You can use any doctor or hospital that takes Medicare anywhere in the U.S. with the Original Medicare option. Now, Medicare Advantage, which is also known as Part C, those are the all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D. These plans may have lower out-of-pocket costs than Original Medicare, and in many cases, you'll need to use the doctors that are in the plan's network. Now, most plans will offer extra benefits that Original Medicare doesn't, like vision, hearing, and dental. Now let's take a closer look at Original Medicare Part A and B. Medicare Part A is the hospital insurance, and it helps pay for medically necessary services in a hospital inpatient care setting with coverage for a semi-private room, meals, general nursing, and other hospital services and supplies. This does include inpatient psychiatric care as well. It's also going to help pay for medically necessary services at skilled nursing facilities, not related to custodial or long-term care, but when certain conditions are met. It will also help cover the home health care aspect, hospice care, and blood transfusions needed as an inpatient. Medicare Part B covers a number of medically necessary services and supplies where there may be certain requirements that must be met, but those medically necessary services and supplies that are covered can take place in a doctor's office, at an outpatient medical or surgical facility. It'll help cover some home health care services, durable medical equipment, and preventative services like exams, lab tests, screenings, shots to help prevent, find, or manage a medical problem, and preventative services that may find health problems early when treatment will work best. While technically Part D is optional, in most cases there are penalties to not enrolling in the prescription drug coverage. Part D is the most complicated part of enrolling in Medicare, as it involves researching plans, comparing prices, and more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. And for those with limited income and resources, you may be able to get extra help to help pay for your prescription drug plan. There's also different rules for you on how to choose your plan than there would be for anyone who doesn't have that extra help assistance. Now, if someone's already receiving Social Security benefits, for example, they're getting early retirement, then they would be automatically enrolled in Medicare Part A and B without an additional application. They will receive an initial enrollment period package, which includes their Medicare card and other important information about 3 months before they turn 65 or 3 months before their 25th month of disability benefits. Coverage will begin on the 25th month of disability benefits. Now, if someone is not getting Social Security or Railroad Retirement Board benefits, for instance, perhaps you're still working, then you will need to sign up for Part A, even if you're eligible to get it premium free. And you should contact Social Security 3 months before you turn 65. And if you were working for the railroad, you'll want to contact the Railroad Retirement Board to sign up. And Medicare is going to be administered by the Centers for Medicare and Medicaid Services. While Social Security is responsible for the enrollment for most people into Medicare, the Railroad Retirement Board is responsible for enrolling railroad retirees. So again, if you are not receiving Social Security or Railroad Retirement Board benefits, you will have to enroll with Social Security or the Railroad Retirement Board at least 3 months before the month you turn 65 and are eligible for Medicare. Now, if you're not automatically enrolled, you can choose to sign up for Part B during your initial enrollment period. That means that you can enroll anytime during the 7-month initial enrollment period that begins 3 months before the month that you become eligible for Medicare. You can choose whether you want to enroll in Medicare Part B. And if you're going to enroll in Medicare Part B for 2023, the monthly premium is going to be $164.90. Now, Social Security does advise people to apply for Medicare benefits 3 months before turning 65. You don't have to be retired to get your Medicare, and the full retirement age for Social Security retirement benefits is now at 66 for persons that were born between 1943 and 1954. And it will gradually increase to 67 for persons born in 1960 or later. But you can still receive full Medicare benefits at the age of 65. When you sign up during the first 3 months of your initial enrollment period to get your Medicare Part B coverage effective the month that you turn 65, if you enroll during your birthday month or the months after, your coverage will start the first day of the month after you enroll. Now, if you wait to sign up for the last 4 months of your IEP, that's your initial enrollment period, you will not start your Medicare Part B on your birthday month. It will be the month after you make that initial enrollment period happen. So if your birthday is in October and you don't enroll 3 months prior or at any point 3 months prior, and you choose to enroll in October, that coverage would be effective November 1. This is a look at the original Medicare ID card. It is red, white, and blue, and it is used when a beneficiary gets health care. The Medicare card shows the Medicare coverage, whether it's hospital Part A only or A and B, and the date in which the coverage starts. Your card may look slightly different from this one, but it will still be valid. And I say that because each card is created with a unique claim code just for you. Instead of using social security numbers, they are utilizing a unique combination of numbers and letters. And this ensures that you are the only person receiving your coverage on that card. Now, if you choose that you don't want Medicare Part B at the time when you receive this card, you can follow the directions on the back, return it, and delay that enrollment into Part B. Now, that may not work for everyone, so we'll touch base on that here in just a few slides. Now let's take a look at the coordination of benefits. If you have Medicare and other health insurance or coverage, each type of coverage is called a payer. When there's more than one payer, coordination of benefits rules will decide who pays first. The primary payer is who pays what's owed on the bills first. Then it's sent off to the secondary payer. And in some rare cases, we've seen third-party payer or tertiary. But what does it mean to be the primary or secondary payer? Well, the insurance that pays first is the primary payer. They're going to pay up to the limits of their coverage. And the one that pays second is the secondary payer. They're only going to pay if there are costs that the primary insurer didn't cover. Now, the secondary payer, which could be Medicare, may not pay on all of the uncovered costs. Job-based insurance is insurance that's offered by an employer or a union for current employees and family members. Job-based insurance allows you to delay Medicare enrollment without negative consequences in some situations. However, you may want to enroll in Medicare depending on whether your job-based insurance pays primary or secondary. In most cases, you should only delay enrolling in Medicare Part B if your job-based insurance is the primary payer, meaning that it pays first for all of your medical bills, and Medicare would be secondary. And if that's the case, you will have a special enrollment period to enroll into Medicare Part B when you lose your job-based coverage. If you're eligible for Medicare because you are 65 or older, job-based insurance will be considered secondary if it's from an employer with fewer than 20 employees. Medicare will be listed primary in this case, and if you delay your Medicare enrollment, your job-based insurance may provide little or no coverage. You should enroll in Part B to avoid incurring high costs for your care. Now, if you have Medicare because you are 65 or older, your job-based insurance is going to be listed primary if it's from an employer with 20 plus employees. Medicare will be secondary in this case, and some people choose to not enroll in Part B because of its monthly premium. In 2023, that is $164.90 monthly. Now, if you're eligible for Medicare because you've received Social Security disability insurance payments for 24 months, your job-based insurance will be secondary if it's from an employer with fewer than 100 employees. Medicare will be primary in this case, and again, if you delay that enrollment, your job-based insurance may provide little to no coverage. So you should enroll in Part B to avoid incurring high costs for your care. If you're covered under Medicare because you have disability and have received disability payments for at least 24 months, job-based insurance is going to be primary if it is from an employer with 100 or more employees. Medicare in this case will be secondary, and again, some people choose not to enroll in Part B at that point because of the additional monthly premium. Again, for 2023, That monthly premium is $164.90. Now, if you have a health savings account, which is an account for individuals with high deductible health plans, funds that get contributed to the HSA are not taxed when they are put into the HSA or when taken out, as long as they are used to pay for qualified medical expenses. Your employer may oversee your HSA, or you may have an individual HSA that is administered by a bank, credit union, or insurance company. But if you have an HSA and you will soon be eligible for Medicare, it's important for you to understand how enrolling in Medicare will affect your HSA. With a high deductible health plan, in order to qualify to put money into an HSA, you must be enrolled in a high deductible health plan, and you may not have any other health insurance, including Medicare, or coverage from a spouse or a family member. High deductible health plans have large deductibles that members must meet before receiving coverage. This means a high deductible health plan member is going to pay in full for most healthcare services until they reach their deductible for the year. Afterwards, that high deductible health plan then covers all the members' costs for the remainder of the year. If you're enrolling into Medicare when you have a health savings account or HSA and you enroll into A and or B, you can no longer contribute pre-tax dollars to your HSA, because with an HSA, you cannot have any other health insurance other than that high deductible health plan. Now, the month that your Medicare begins, you should stop contributing to your HSA. However, you may continue to withdraw money from your HSA after you've enrolled in Medicare to help pay for medical expenses such as deductibles, premiums, copayments, and coinsurances. If you use your HSA account for qualified medical expenses, the funds will continue to be tax-free. Whether you should delay enrollment into Medicare so you can continue contributing to your HSA really depends on your circumstances. So if you work for an employer with fewer than 20 employees, you may need Medicare in order to have primary insurance, even though you would lose the tax advantages of your HSA. This is because health coverage from employers with fewer than 20 employees pays secondary to Medicare. If you work at this kind of employer and fail to enroll in Medicare, you may have little or no health coverage because your health plan does not have to pay until after Medicare pays. Health coverage from an employer with 20 or more employees pays primary to Medicare, so you could choose to delay your Medicare enrollment if you work at this kind of employer and continue putting funds into your HSA. But you must delay both Medicare Part A and B in order to do so. And note, in either case, you'll be able to enroll in a Part A and have access to Part B with a special enrollment period when you lose coverage or retire. If you choose to delay Medicare Part A and B enrollment because you are not working and want to continue contributing to your HSA, you must also wait to collect Social Security retirement benefits. This is because most individuals who are collecting Social Security benefits become eligible for Medicare automatically and get enrolled automatically into Medicare Part A. You cannot decline Part A while collecting Social Security benefits. Retiree insurance is a form of health coverage an employer or union may provide to former employees. Retiree insurance is almost always secondary to Medicare, meaning it pays after Medicare and may provide coverage for Medicare cost sharing like deductibles, copayments, and coinsurance. But because retiree insurance is secondary, you should enroll in Medicare to be fully covered. You may be able to keep your retiree insurance as primary after you become Medicare eligible if you have end-stage renal disease or federal employee health benefits. The decision to keep retiree coverage after you enroll in Medicare is a personal one, and it's going to depend on your costs and anticipated healthcare needs. Retiree coverage premiums can be costly, but it may be worthwhile to keep that plan if you anticipate high Medicare costs. Retiree coverage may also pay for other care items and services that Medicare does not, like vision, dental, and/or off-formulary or over-the-counter prescription drugs. If the plan offers prescription drug coverage that you like, find out if that coverage is considered creditable. If it is, you can delay Medicare Part D enrollment without penalty. For more information on the services covered by your retiree insurance plan, contact your benefits administrator or your employer's human resources department. Retiree insurance may coordinate with Medicare differently depending on the type of plan that you have. Below are a few common types of plans and how you might expect them to work with Medicare. Be sure to speak with your employer's HR department for more information. Fee-for-service plans pay for the care from any doctor or hospital, and fee-for-service plans cover Medicare cost sharing and generally act like a supplemental insurance policy. Managed care plans like HMOs and PPOs, those ones require you to see in-network providers at in-network facilities. Your costs are typically lowest when seeing providers who take both Medicare and your retiree insurance. But when seeing Medicare providers who do not take your retiree insurance, you will pay regular Medicare cost-sharing amounts, and your retiree insurance may not pay at all. Employee-sponsored Medicare Advantage plans offer Medicare-eligible individuals both Medicare and retiree health benefits. Some employers require that you join a Medicare Advantage plan to continue getting retiree health benefits after becoming Medicare eligible. You can always choose not to take your employer's coverage and sign up for Original Medicare or a different Medicare Advantage plan. But keep in mind that you may not be able to get that retiree coverage back if you want it at a later date. Employer-sponsored supplemental insurance policies offer secondary coverage for Medicare-eligible individuals. These plans often function similarly to Medicaps, meaning that they're going to pay all or part of certain remaining costs after Original Medicare pays first. Remember that you can always choose not to take your employer's coverage and sign up for a Medicare Advantage plan or Original Medicare with a Medigap policy, but you may not be able to get that retiree coverage back if you want it at a later date. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, is a federal law passed in 1986 that lets certain employees, their spouses, and their dependents keep group health plan coverage for 18 to 36 months after they leave their job or lose coverage for certain other reasons, as long as they pay the full cost of the premium. Under COBRA, a GHP, group health plan, is defined as a job-based insurance plan that provides medical benefits to employees, their spouses, and/or their dependents. As you make COBRA-related decisions, keep in mind that health coverage under COBRA is typically expensive because it tends to be comprehensive, and you may pay the full cost of the premium yourself. Employers often pay the part of the premium for their current employees. However, COBRA coverage could be less expensive or more comprehensive than similar individual health care options. The way that COBRA and Medicare coordinate depends in part on which form of insurance that you have first. While it is possible to get COBRA if you already have Medicare, it is not usually possible to keep COBRA if you have it before you become Medicare eligible. Specifically, whether you can have both COBRA and Medicare depends on which form of insurance you have first. Also, COBRA pays secondary to Medicare. If you have COBRA when you become Medicare eligible, your COBRA plan will no longer be obligated to keep you enrolled. So your COBRA coverage will usually end on the date your Medicare Part A and/or Part B becomes effective, even if you do not enroll on time in Medicare. COBRA pays secondary as soon as you're eligible, and without Medicare, you may be responsible for your medical bills in their entirety. You should enroll in Part B immediately when you become eligible because you are not entitled to a special enrollment period when COBRA ends. Your spouse and dependents may keep COBRA for up to 36 months, regardless of whether you enroll in Medicare during that time. You may be able to keep your COBRA coverage for services that Medicare does not cover. For example, if you have COBRA dental insurance, the insurance company that provides your COBRA coverage may allow you to drop your medical coverage, but keep paying a premium for the dental coverage as long as you are entitled to COBRA. You should contact your plan for more information on that. Now, if you have Medicare Part A or B when you become eligible for COBRA, you must be allowed to enroll in COBRA. Medicare would be considered the primary insurance and COBRA would be secondary. You should keep Medicare because it is responsible for paying the majority of your healthcare costs. While COBRA is typically expensive, it may be helpful if you have a high medical expense and or your plan covers your medical cost sharing or offers other needed benefits, or if the COBRA policy also covers other family members who are not Medicare eligible. If you're eligible for Medicare due to end-stage renal disease, your COBRA coverage is primary during the 30-month coordination period. For federal employee health benefit plans, those are going to cover current and retired government employees. They are administered by the Office of Personnel Management, or OPM. Federal employee health benefit plans follow some of the same coordination of benefit rules and rules for delaying Medicare enrollment as non-federal job-based insurance and retiree insurance, with a few important exceptions. Because you or your spouse work for the federal government employer with 100 plus employees, the federal employee health benefit is always primary during active employment. Additionally, if you meet other requirements, you will have a special enrollment period to enroll into Part B when you are no longer covered by the federal employee health benefit insurance based on your current work. Unlike other retiree insurance, federal employee health benefit plans will pay primary for retirees who do not enroll in Medicare Part B. Federal employee health benefits are only secondary if you enroll in Part B. Whether to enroll in Part B or use the federal employee health benefit as primary coverage is a personal decision. It's going to be based off your individual circumstances. You should look at the costs and the benefits of each insurance plan and make the choice that is best for you. Some questions to consider could include: which forms of insurance do your providers take? What kind of services do you use regularly? Which coverage offers the flexibility that you need? And if you decide to enroll in Part B, you should do so within 8 months after you no longer have federal employee health benefit coverage from your current employment. Review your federal employee health benefit plan brochure for more details. And just note that you may be unable to enroll in the federal employee health benefits again if you disenroll. Now, if you stay enrolled in the federal employee health benefits and take Part B, Medicare will be primary, and the federal employee health benefits may cover your Medicare cost sharing, like deductibles, copayments, coinsurances. If you stay enrolled in the federal employee health benefit plan and do not enroll in Part B, your federal employee health benefit plan will continue providing the same coverage that it did when you were actively employed. Note that some individuals choose to enroll in Part A because it is premium free, but turn down the Part B because of the additional monthly premium. Those who want to enroll in Part B in the future may face penalties, and they may end up having to wait to enroll until the general enrollment period. If you keep federal employee health benefits, you must continue paying the full federal employee health benefit premiums, regardless of whether you take Medicare or not. Special enrollment periods are periods of time outside of normal enrollment periods where you can enroll in health insurance. They are typically triggered by specific circumstances, and the Part B special enrollment period is a period of time when you can enroll in Medicare Part B after your initial enrollment period. You can use the Part B special enrollment period while you are covered due to current work and for 8 months after you no longer have coverage from your current work, job-based insurance. Using the Part B special enrollment period also means that you will not have to pay a Part B late enrollment penalty. If you are considering delaying Part B enrollment because you have job-based insurance, Make sure to also learn whether your coverage will be primary or secondary. To use the Part B SEP, or special enrollment period, you will need to meet 2 criteria first. You must have insurance from your current work, your job, your spouse's job, or sometimes another family member's job, or have had such insurance within the past 8 months, and you must have been continuously covered by job-based insurance or Medicare Part B since becoming eligible for Medicare. Please note that you are ineligible for Part B special enrollment periods if you go more than 8 months in a row without coverage from Medicare or insurance from current work. You also specifically must be covered by either Part B or insurance from your current work during the first month of your Medicare eligibility, unless you use your initial enrollment period to enroll in Medicare. In most cases, you should enroll in Medicare immediately after your job-based insurance ends. This is to avoid gaps in coverage. Even though your special enrollment period may last for several more months, even if you use your SEP to avoid a late enrollment penalty, you may still be responsible for any health care costs that you incur in the months after losing your job-based coverage, or after your coverage becomes secondary before your Medicare coverage takes effect. And if you plan to delay enrollment into Part B and use the special enrollment period later, keep records of your health insurance coverage. You will be required to submit proof of your enrollment in job-based insurance when accessing the special enrollment period. Proof of enrollment in job-based insurance includes written notice from your employer or plan, documents that show health insurance premiums that have been paid, including W-2s, pay stubs, tax returns, and/or receipts, and health insurance cards with the appropriate effective dates. If you're covered by creditable drug coverage, you can delay Medicare Part D enrollment without penalty. Creditable drug coverage is on average as good as or better than the basic Part D benefit. If you have drug coverage through an employer plan, you should receive a notice from your employer or the plan around September of each year. This is informing you that if your drug coverage is creditable or not. If you've not received this notice, contact your Human Resources Department, the drug plan, or benefits manager. Be aware that this information may not come as a separate piece of mail, and it can be included with other materials like a plan newsletter. Several types of plans that offer creditable drug coverage include the Veterans Affairs Benefits, or VA benefits, TRICARE for Life, or TFL, Federal Employee Health Benefits, the FEHB, and some job-based and retiree plans. If you have one of the above forms of coverage and they have not provided you with written proof of creditable coverage, request this notice from your benefits administrator. If you're considering delaying Part D enrollment because you already have prescription drug coverage, make sure to find out if your coverage is considered creditable. Maintaining enrollment in creditable drug coverage means that you will not incur a late enrollment penalty for delaying Part D enrollment. Additionally, having creditable coverage means that if you learn that you're going to lose such coverage and you want Part D coverage, you then will have a 2-month special enrollment period to enroll in Part D plans. Remember, if you decide to delay enrollment in any part of Medicare, keep a record of your insurance until you enroll in Medicare. You may need this documentation in order to sign up for Medicare later. For each 12-month period that you delay enrollment into Medicare Part B, you will have to pay a 10% Part B premium penalty unless you have insurance based on you or your spouse's current work. That's job-based insurance, or if you are eligible for Medicare Savings Program. This 12-month period does start after your initial enrollment period ends. And remember, your initial enrollment period is the 3 months before, the month of, and 3 months after your 65th birthday month. In most cases, you will have to pay a penalty every month for as long as you have Medicare. If you're enrolled in Medicare because of a disability and you're currently paying premium penalties, Once you turn 65, you'll no longer have to pay the premium penalty. But like all Social Security enrollment decisions, you can appeal your Part B late enrollment penalty. To appeal, follow the instructions on the notice that you receive informing you of your late enrollment penalty. In order to appeal successfully, you're going to need to prove that you were enrolled either in Part B or in coverage through current employment during the time period that you were penalized for. If you can, have your employer fill out the CMS L564 form and request for employment information, showing that you or your spouse were employed and covered by insurance through current employment during the relevant time frame. If your appeal is unsuccessful, you will have the right to request a hearing by administrative law judge. You can follow the instructions on your appeal denial to request an administrative law judge hearing. For more information and assistance about the Part B late enrollment penalty appeals, contact your MAP program. MAP can help you in more ways than you could ever know. So let's say that you do delay enrollment into Part B for 7 years and you didn't have employer insurance, which would allow you to delay the enrollment without penalty. Your monthly premium would be 70% higher for as long as you've had Medicare, which is 7 years times 10%. Since the base Part B premium in 2023 is $164.90, your monthly premium with a penalty would be $280.33 total. That's because we take $164.90, multiply it by 70%, which gets us $115.43. That's the penalty amount, and it gets added to the $164.90 monthly premium, bringing it to a total of $280.33 per month. Please note that although your Part B premium amount is based on your income, your penalty is calculated based on the base Part B premium. The penalty is then added to your actual premium amount. Now, for each month that you delay enrollment into Medicare Part D, you will have to pay a Part D late enrollment penalty unless you've had creditable coverage, meaning your coverage is as good as or better than the basic Part D benefit, or you qualified for the Extra Help program, or you prove that you received inadequate information about whether your drug coverage was considered creditable or not. In most cases, you will have to pay the penalty every month for as long as you have Medicare. Even if you're enrolled in Medicare because of a disability and currently pay a premium penalty, once you turn 65, you'll no longer have to pay the penalty with it. In most situations, you must pay the Part D late enrollment penalty as long as you're enrolled in Medicare prescription drug coverage. There are some exceptions. Again, if you receive extra help, your penalty will be permanently erased. If you are under 65 and have Medicare, your late enrollment penalty will end when you turn 65. And if you were to qualify for a state pharmaceutical assistance program. We currently do not have any state pharmaceutical assistance programs, but we are happy to always check back and look into those as the assistance is provided. If your Part D plan determines that you had a break in creditable coverage for more than 63 days, you may have a late enrollment penalty. If your plan has reason to believe that you had a break in creditable drug coverage for more than 63 days, they should contact you and ask you to provide a verbal or written statement of creditable drug coverage. This statement is an attestation, and if you do not attest to the plan that you had creditable coverage, then your plan should mail you written notification that you have a late enrollment penalty. A late enrollment penalty reconsideration notice and a late enrollment penalty reconsideration request form as well. Now, the late enrollment penalty reconsideration notice explains your right to request a reconsideration of your late enrollment penalty. Everyone has the right to appeal their late enrollment penalty. the late enrollment penalty reconsideration request form. This is the form that's used to appeal the late enrollment penalty with Maximus, which is the company contracted by Medicare to handle the appeals. So you should complete your late enrollment penalty reconsideration request form that you receive from your plan, attach any evidence that you have, and mail everything to Maximus to handle your appeal process if you feel that the late enrollment penalty was unjust or calculated incorrectly. And by unjust, it's because you feel that you were continuously covered by drug coverage that would be considered creditable. So let's say that you delay enrollment in Part D for 7 months and you do not meet any of the exceptions that we've talked about prior. Then your monthly premium would be higher by an amount that is 7% of the national base premium for as long as you have Part D. So 7 months times 1%. The national base beneficiary premium in 2023 is $32.74 a month, and your monthly premium penalty would therefore be $2.29 per month, because we take 1% of $32.74, multiply it by 7, which gives us the $2.29 amount. This again is what you would pay in addition to your plan's monthly premium. Note that the Part D penalty is always calculated using the national base beneficiary premium, so your penalty typically will not decrease if you enroll in a Part D plan with a lower monthly premium, nor will it increase if you enroll in a Part D plan with a higher monthly premium. Now, MAP can assist you with anything if you feel that you are a victim of fraud or abuse. Medicare fraud is the most common scheme that affects Medicare beneficiaries. It can be as simple as Medicare or Medicaid being billed for services that you never received, equipment that you never received or you returned, if someone uses your Medicare or Medicaid ID card, or if a company uses false information to mislead you into joining a Medicare plan. Please call MAP if you or someone you know feels that they are a victim of fraud or abuse. You can call MAP so that we can help report it and stop the continuation of fraud and abuse. MAP is here to help. If you'd like to speak with a counselor about your specific situation, give us a call. Our number is 800-803-7174. We're currently counseling over the phone, through Zoom, and in person where available. Our services are completely confidential and unbiased, and no question is too trivial, and we often deal with very complicated questions as well. And for resources outside of MAP, you have access to the Medicare New Book, which is state-specific, showing specific plans for Michigan. You will receive a hard copy each fall, but you can access an electronic version all year online. There's also access to Medicare.gov, which is Medicare's plan finder and website. And of course, you can always call 1-800-MEDICARE. However, for the best resource for your local Medicare information, that is going to be MAP. Our services are free, they're unbiased. Our certified counselors are not sales agents, and they are not affiliated with private insurance companies. We can be your best resource for all questions and concerns Medicare. No questions too small or difficult, and we have saved over $2 million for beneficiaries in your area. Thank you so much for joining me. Again, my name is Melissa Devine. I am one of the site coordinators with the MAP program here in Region 1B. If you have any questions or if you would like to reach out to me, you are welcome to. My email is listed here, and it is mdevine@aaa, the number 1, b as in boy.org. Thank you so much and have a wonderful day.